Hello.
Am I audible now? Is this much space is fine? Or I need to be a little bit more loud? This is fine? Fine.
Hello.
She can hear.
Okay. But once you talk.
Done.
Talk.
Oh.
Once you talk.
Okay. It's you can hear me, Prithvi. You can't hear me. I think.
Yes, Mavi, I can hear you. Just be a bit louder. That's it.
Okay.
It's fine. We are good to go.
Okay.
Thanks.
Fine. So Nitesh, when I say can we have the next slide, then you just put the next slide.
Okay, sure.
Okay. After she introduced me when I stand, no, Start? Okay. Good afternoon, everyone. Thank you for joining us for this today breathing technique. So I'm a physiotherapist and my name is Moy. I'm basically working in Shakanagar, Bangalore. And I'm basically a child birth educator also, Namas child birth educator. And today we will be talking about how can you take care of yourself during the labor. Okay. Now there is one of our physiotherapists who is Dr. Surya Lakshmi. She is basically currently in Malaysia, so she will be answering your questions. Okay, so I would request everyone to kindly listen to whatever I speak about. If you have any doubts later on, like after the session, she will still sit on for another 10 minutes to answer your doubts. So you don't need to hurry. Okay, so please, if you want, then you can write through. If you want, then you can just listen, and then if you have your doubts, you can always get in touch with us as well. Okay. So yeah, the first thing in the slide which we have is like woman body is designed to give birth and to nurture a baby. Okay, so this is a very, very powerful statement. Okay, so today what we want you to do is we want you to take from this session is basically your body is capable to birth your baby. Okay, so with all this breathing technique and all the physiological things which is happening in your body during the labor, okay, we want you to feel confidence during your labor. Okay, that's the main thing which we want you to take it home today. Okay, so first we will come on to the signs of labor. Okay, so everyone, Nitesh, can I have the signs of labor, the second slide?
Yeah.
Okay, fine. So when we talk about the signs of labor, okay, so there you might be confused because many people will be telling, oh, this was my sign of labor. So in this sign of labor, we have written down 4. Okay, so for some people, it can come in a sequence. For some people, one thing might not come, especially the diarrhea, let's say. Okay, so you have to listen to your body closely, but understanding what are the signs of labor will help you know when you have to go to the hospital, right? So first thing I will just explain about the diarrhea. Okay, so as your body is slowly getting ready for the labor, okay, so even your body is slowly getting ready for the labor, for the contraction. So what happens is there are surge of changes in the hormonal in your body. So basically what happens is that your body wants to give more space. So what happens is your body is telling, oh fine, I need to empty my bowel. Okay, so what happens is that's when you start having a little bit of loose motion. Okay, you feel a little nauseous. Okay, so if you have loose motion, you have nausea or something like that, okay, make sure you hydrate yourself well and please let your consultant know about it. Okay, so that is the first thing. It doesn't mean that you need to rush to the hospital, but then make sure you let your gynec know about it and make sure you're hydrating yourself well. Okay, so that means okay, fine, labor is very much nearing, but it might not be like within 2-3 hours you will have a labor. It's not like that. Okay, you might still take a little bit more time, but that means that your body is slowly getting ready for the labor. Okay, first thing. Second thing, the back pain. So some people used to have a dull aching pain during the pregnancy. Okay, so many people have a lower back pain, but then during the whole pregnancy, many women, what happens is when they have back pain, something triggers. Like for example, they turn on the side, it's painful, or they sit for a longer time, it's painful, right? So, but then this lower back pain during when you are going to start having labor, it will be there constantly. Okay, it will not go away. You move around, you walk around. The pain will little subside, but then as the hour goes by or as the day goes by, it increases its intensity. Okay, so it will be basically on the lower back. And so many women used to tell me, oh, I started having a lower back pain 2-3 days before my labor. Okay, and then slowly it's increasing its intensity. It comes towards my tummy. I started having contractions. So many people used to tell me that, but some people used to tell me, oh, I start having this lower back pain. And then I was walking around, I was moving around, I did my normal activities. After 3 days, I started having my own contraction, but my contraction and my lower back pain is totally different. So every person is different. Okay, so as I told you, if you during pregnancy, if you already have a lower back pain, something triggers, you walk around or else you turn around, it is painful. But then this lower back pain nearing your labor, it will be there constantly, and as the day goes by, it increases its intensity. So if you start having this lower back pain, don't panic. You please let your gynec know about it, but then you don't need to rush to the hospital. Okay, now the third one is the contraction. So when we talk about contraction, right, contraction is the time when your uterus is trying to push your baby down. Okay, so in the early labor, we will be talking again more further. Okay, but then contraction is basically physiologically your uterus is trying to push your baby down. That's why you have the contraction. Okay, so contraction, how will you feel? Okay, so let's say your uterus is almost like going till here, right? So when you have the contraction, you'll feel the tightness on your abdomen. Okay, so many women, when they are already 36 weeks, they will say, oh, my tummy is already tight, how will I know I'm having contraction? Okay, so if you, when you have the contraction, your tummy will be as hard as your forehead. If you touch your forehead, is very hard inside, right? It will be as hard as your forehead, and you will feel like how during your periods you're having a cramping, so something like that. Okay, but it might be a little bit more intense for the early labor. You will have a contraction of maybe 30 to 40 seconds. Okay, then you will have a relaxation phase where you don't have contraction at all, no contraction. Then the same kind of a contraction will be there for another 30 to 40 seconds, then it will go away. So once you start having a series of contraction, relaxation, contraction, and relaxation, so when it is in a sequence, that's when you come to know that you are in true labor and you have to go to the hospital. Okay, so that is basically a true labor. We call this one as a true labor. Now, many people will ask me, okay, how will I know if it is my true labor contraction or if it is a false labor pain? A false labor pain, what happens is that you have a tightening of your tummy, okay? But what happens is that it is very irregular. Sometimes you have the contraction for almost like 1 minute and it goes away. After 5-10 minutes, it comes back and then it goes away and it comes back after 2-3 hours. So it is very irregular, okay? So that's how you can appreciate what is a true labor pain and what is a false labor pain. Okay, and then when you talk about a false labor pain, when you walk around and you change position, sometimes most of the time it goes away. Okay, a true labor pain, when you walk around, when you change position, it will be there constantly. Okay, so in that way you come to know what is true labor pain and what is false labor pain. Okay, so if you start having a true labor pain, okay, please let your gynec know about it. Okay, and then you can go ahead if you have to go to the hospital, or you might have to stay back for some more hours. So please let your gynec know about it immediately. Okay, now because now you already know what to tell your consultant. Basically, when you call your consultant, she might be telling you, okay, how frequently you're having the contraction. You can tell her, oh, every 10 minutes I'm having the contraction of 60 seconds or maybe 30 seconds or 40 seconds. Then she can know that, okay, fine, she might be in these stages of labor. Okay, so now you know what you can tell to your consultant as well, right? Now the last one is the water breakage. Okay, so what happened in the water breakage? Okay, baby is nicely, happily moving in your womb, water surrounded by water. Okay, so what happens is the baby is basically protected in the membrane. Okay, so sometimes what happens is the membrane ruptures and then the water gushes out. Okay, so if you feel like, oh, I didn't pass my urine, but then my inner wear is getting wet, or you feel like, oh, something is like coming down, like how I'm having my periods and then my clothes are getting wet, but I didn't pass urine. Okay, so if you feel something like that, then no question asked, please come to the hospital. Okay, if water breakage didn't happen, be happy, go back home. Okay, but then if water breakage happened, then you might have to stay back up to the hospital. So in case if you have all these things, like for example, your clothes are getting wet without you passing urine, sudden gush of water coming down, okay, or else you feel like, oh, you're having a mild kind of a leakage, so that is, but then you didn't pass urine, that means most probably water breakage happened. Okay, so if that's the case, then please come to the hospital. Okay, so that is basically what you come to know. I think now you will know how to handle the signs of labor. Okay, another one which is not there is basically the plug of mucus. Okay, plug of mucus is basically the one which seals your cervix. Okay, so I will just have this balloon with you. Okay, so let's say this is your cervix, this is your uterus. Okay, let's say this is your vaginal opening. So your cervix is basically closed very tightly during the pregnancy. Okay, so what happened here is that when your body is slowly getting ready for the labor, these very thick cervix tends to become very soft and it becomes more and more thinner. Okay, so once that becomes thinner, the plug of mucus used to come out. It can be pinkish in color, it can be brownish in color. Okay, that means it's a very good sign that, oh, fine, I'm going to have my labor some in some days or maybe in some hours. Okay, so if you have this plug of mucus, please don't panic. please let your gynae know about it. Okay, so that can be one part of the signs of labor. Okay, so we finish the signs of labor, we come on to the second, the second slide, that's basically the stages of labor. So we have 4 stages of labor. Okay, I think we are in the stages of labor, right? Okay, so the first stage is basically when a mother is 0 to 10 centimeter dilated. And then the second stage is basically when mother is 0 centimeter to the baby delivering. Okay, third stage is basically when baby is delivered and the placenta still needs to come out. So basically delivering the placenta is basically the third. Fourth is basically once you finish delivering the placenta and till 4 hours post delivery. So that is basically the 4 stages of labor. Okay, now we can go on to the next slide, that is basically cervical effusion. So many women used to ask me like, how will I know if I am dilated? How will I know? Okay, so generally you will be not knowing because it is inside you. Okay, so what happens, let's say this is your uterus again. So can I have that one? So this is your uterus, let's say this is the pelvis. Okay, so what happens, like it is inside like this, right? So generally what happens here is that this is basically what is happening, right? So you cannot see what is the dilation. Your consultant will come to know when she is doing the internal examination. But then physiologically, what happened here is that when you have the contraction, okay, so our uterus is also made of smooth muscle, right? So when you have the contraction, what happens is that upper side, it basically pushes down and the side tries to pull it together. So that's basically when you have the contraction, this is what happening. Okay, so slowly, let's say the ball is the baby head. So as you are contracting, baby head is slowly going down and you can see there is a change in the length of it, right? So that's basically when we tell that there is the when the cervix is becoming shorter, that's basically we call that one as effacement. The second in the picture you can see, right? Then on the third one, what happened here is that let's say we are having the contraction. Okay, we have the contraction. And then what happened here, you can see, you can start seeing the baby's head over here, right? So basically what happens is when you are fully dilated, the cervix is fully dilated, that is when we call this one as a full dilation. Okay, so I hope that is pretty clear with you right now, because many people used to be very confused about what is the dilation. That is basically what the dilation. Okay, so that is what I just want to show you over here. Okay, now we will go on to the next slide. That is basically the stages of labor. Okay, now then in the stages of labor, right, the latent phase is basically the early labor. Okay, so here you will be from 0 centimeter dilation to 3 centimeter dilation you will be. Okay, in the active phase, that's basically when the contraction becomes a little bit more intense. Okay, and your labor will also be like 2-3 hours go down. Okay, so that's the time when it becomes more intense also. That is called the active phase. Now when your cervix is almost like 7 centimeter to fully centimeter dilated, that is basically called as the transition phase. Okay, so that is basically the stages of labor. Now in the latent phase, okay, this is the time you will have a contraction of maybe 30 to 40 seconds. Okay, so you have the contraction. Okay, then you'll have a relaxation phase where you don't have contraction at all, but you will still have the lower back pain. Okay, so later on we will be talking about the breathing as well in this kind of contraction, how you can breathe. We will go on to that after some time. Okay, so during this time, mama might be a little excited. Okay, during this time you'll be excited. Oh, finally I started having my contraction. I'm going to see my baby soon, right? Then what happens, you might be already in the hospital during that time. Then slowly as the hour goes by, right? Okay, your contraction becomes more intense. Intense means it becomes more painful. It stays little longer, okay, and it comes more frequently. Okay, so this is how you will come to know that you are progressing with your labor. Okay, so in the beginning, as I told you, in the early phase of labor, you will have a contraction of maybe 30 to 40 seconds. Once you reach your active phase, you have a contraction of maybe almost 1 minute, 60 seconds. Okay, it will become more intense. The contraction will become more intense, and every 5 minutes to every 8 minutes, the contraction will come back. Okay, so because in the early phase, I told you will have a contraction of 30 to 40 seconds. Then you have a relaxation phase of at least 10 minutes. Okay, now as your labor progresses, you have a contraction of almost 1 minute, that is 60 seconds, and every 5 minutes to 8 minutes, you will have the contraction again. Okay, so that is basically the active phase. So during this time, it will be pretty more intense. You might not able to smile also during this time. You will start a little bit thinking, oh, I have been in labor for too long, and they are still telling, oh, I'm just 3 centimeter dilated. How will I, you start doubting yourself during this time. Okay, so this is the time when the labor partner is very, very important. That's basically that to be, right? So you will be the labor partner for your wife, right? So during this time, it is your job to, tell that, okay, you're doing good, and we will go through this one. So that is when you are going to give a very good support. Okay, and we will, as I told you, we will be I'll be teaching you the breathing as well. Okay, so that is the active phase. Now during the transition phase, okay, transition phase is the time when most of the mother try to give up. Okay, so we don't want you to give up, because what happens at transition phase is a short phase. Okay, so it might be 1 hour, it might be 2 hours, but it is much, much more shorter. It's like you have to climb 10th floor and you have already climbed the 8th floor, right? So you just need to climb the last 2 floor. Okay, so that, just remember that if you reach this phase, that means you're going to see your baby soon. Okay, so please don't try to lose your hope. Okay, tell yourself that I'm doing good, I'm strong, my baby is doing good, and I'm going to do it. Okay, so you can always tell yourself, you can always include your baby and your husband in this one. Okay, so that is basically the transition phase. The pushing phase is basically when your baby head is already crowned on your vaginal opening, and then that's when you have to push your baby out. You don't need to worry, you just need to listen to the nurses and your doctor. Okay, your doctor and the nurses are there to tell you when to push as well. Okay, so listen to them properly. Don't try to give hope, or don't try to lose hope. That's very important. Okay, so that is the pushing phase. Okay, so that is basically the stages of labor and how you might feel. Okay, now coming on to the next slide, that is called the hormones. Okay, hormones, you can see the red color, you can see the blue color on the on the slide. Okay, so here when you are in labor, oxytocin hormone is a labor which is helping you for your labor. Okay, so what happens is when the oxytocin is high, okay, it helps in the contracting of your uterus. Okay, so what happened here is that your body, when you are very calm during contraction, let's say you have the contraction, you're very calm, you're walking around, you're doing the breathing. Okay, your body knows that, oh fine, she's doing pretty well, she can handle the contraction pretty well, so I will start producing more of this oxytocin hormone. So basically what happens is it helps you in the progression of your labor. Okay, so basically when you're calm, it helps in the progression of your labor. Then your body knows that, okay, fine, I have produced good amount of oxytocin, she must be in pain, so I need to start secreting endorphin hormone. Endorphin hormone is basically the hormone which our own body can secrete when your body knows that, yes, she is in pain, right? Okay, so we call this one the runner's high also. If any one of you are in marathon or something like this, when you start running, right, you feel like running more, right? So we call this one as they call this as runner's high hormone also. Okay, so what happened here is that your body gives you all this endorphin hormones, so it helps you progress with your labor. Okay, so that is basically when you are very relaxed during labor. Okay, now the second one is basically the red one, right? When you are very tense during labor, what happens here is that the adrenaline hormone is increasing. That's basically the stress hormone. The stress hormone and the oxytocin hormone cannot come together. If stress hormone is more, oxytocin hormone will slowly come down. Then what will happen? Your labor will become more longer, okay? And then you will start becoming more worried, okay? You'll be worried and you will be having more pain, because what happens is that your body is not secreting the endorphin hormone, right? So what happens is you'll perceive more pain. If you perceive more pain, you'll be more scared. If you're more scared, then you'll be more stressed. So this cycle will go on, okay, which is there on the next slide. Can you have the next slide? So this cycle will go on, okay. So we need to break the cycle, okay. Now, how to break this cycle? That is what we are intending to tell you, okay. So breathing technique we can do, okay, during the contraction. And then you can do the positioning technique, okay. You can watch something which makes you happy, okay. So all these things you can do during labor, okay. So now we will be talking about how can you handle your labor, okay. Now, before I talk about the breathing technique, one thing I want to speak about, okay? Fine. So that is basically why you have the contraction. Why you have the contraction is basically because your uterus is trying to push your baby down. So when you have the contraction, that's when you will be having the pain. Okay. So during labor, okay, don't think that pain is your enemy. During labor, pain is your friend. Okay, so that's what you have to remember. Because if you don't have the contraction pain, you might be at your home or you might be walking, and it's already, it's time for you to deliver your baby, right? So pain is something which is telling your body that, oh, you need to go to the safer place, right? So that's the reason why we want the pain is your friend during labor. And when you have the contraction, okay, don't try to work against your body, okay? Tell yourself that, yes, I'm having a contraction. This is how strong I am. It's on your body, right? Okay, that means how strong you are. So the stronger your contraction is, that's when you have to tell yourself, this is how strong I am. Okay, don't try to give up. Okay, so when you have the contraction, that's when you have to do the breathing. Remember that one. Okay, now Pavana will be helping you with the breathing. Okay, so yeah, we can stop sharing the slide and we can fully focus on the breathing. Okay, please stop. Okay, so basically, I want that to be also with the mama. Okay, so that we can teach them how to do the breathing. Okay, so first thing, okay, contraction start. In the early phase of labor, as I told you, the pain is a little milder. Okay, so what you can do is as soon as you have the contraction, you do the belly breathing, or we call this one as the diaphragmatic breathing or the slow breathing. So you just put your hands on your tummy, nicely breathe in from your nose, slowly. Your tummy will expand and then slowly blow off from your mouth. Okay, good. Slowly breathe in from your nose. Tummy is out, shoulder is relaxed, slowly blow out from your mouth. Good. This is basically how you can do the breathing during the contraction. Okay, so shall we do it again? Slowly breathing in. We'll all do it together. Okay, breathing in, slowly blow out. Good. Breathing in slowly. Good. Slowly blowing out. Good. Breathing in from nose. Breathing out through mouth. Okay, slowly breathing in again. Slowly blowing out again. Relax, relax. Slowly breathing in. Slowly blow out. Okay, 30 seconds is over. One contraction is over. Okay, so in this way, you can even start practicing at home. Okay, so both of you can do it together. Okay, so that is basically when you can still take the pain. But I have seen some of the mothers who are doing this abdominal breathing almost till the time they're ready to push the baby up. Okay, fine. So every person, we don't know what you will be comfortable with. So we are teaching you quite numbers of kitties inside your labor, box. Okay, so whichever kitty you're comfortable with, that's what you're going to do. Okay, so that is basically the abdominal breathing or the slow breathing or diaphragmatic breathing. So when you read about it, please don't be confused. Okay, now as the labor progresses, okay, so what happens is that it becomes more painful. Okay, and you started thinking, okay, how long this labor will be? You started doubting yourself. Okay, so this is basically because what happens, the baby is your cervix is little bit more dilated, baby has started pushing a little bit more on your back also, right? So when you have the contraction, sometimes you will start doing this. You will not breathe. Okay, so that is what we don't want. Now, if you cannot do the belly breathing or the slow breathing anymore, what I want you to do is the chest breathing. Okay, so putting my hands on this area is just for you to see how much expansion it is. Okay, so slowly breathing in, chest is expanded. Slowly blow out. Good. So we call this one as the blow breaths. Okay, breathing in, blow. Breathing in, slowly blow. Breathing in, slowly blow. Breathing in, slowly blow. Okay, so when you feel, oh, the pain is little lesser, I can continue with my deep breathing. Then you can continue with your belly breathing. Slowly breathing in, slowly breathing out. Okay, one contraction is over, right? Okay. So that's basically what you can do during the active phase. Labor will slowly start progressing. Slowly it will go down. It's like a wave. Okay, so as soon as you have the contraction, if you feel you can still do the belly breathing, start with the belly breathing. Slowly breathing in, slowly breathing out, slowly breathing in, slowly breathing out. When you feel like, oh, it's peaking, I cannot do the deep breathing anymore, I started holding my breath. What you do the chest breathing. Slowly blow, breathing in, breathing in, breathing in. When you feel, okay, fine, pain is a little better, I can handle with the belly breathing. So you can do the slowly breathing in, slowly breathing. Okay, so see, one contraction is over again, right? It's almost 1 minute. Okay, so that's how you can go through the labor. Okay, now during the active phase, right, as I told you, many moms started holding their breath and they try to start pushing it downward. So that's the reason why I taught you the blow breathing. So instead of pushing downward, you're blowing it from your mouth. Okay, so that's basically in the active phase. But during the active phase, a mama might forget how to breathe. Okay, so that how can you do is that to be, you can hold your wife. Okay, you cannot tell her that, okay, fine, you have to breathe, you have to breathe. What you can tell her is that, look at me, see how I'm doing. You can initiate the breathing. Tell that we will do it together. So if she sees you doing that one, she will start doing it, okay? Because during labor, right? So a woman is going through a lot of phases. So you have to understand what she's feeling. So you can't just tell her, breathe, 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 okay? Fine, so you have to do it together. You will be a partner, okay? So that is how you can help her, okay? Now, active phase is over, right? Okay, now when the active phase is over, during the transition phase, when the pain increases, women become more vocal. Some people start yawning. They start doing, okay. As long as you do breathing, we don't mind. Some people yodel also. They start doing, no problem, okay. As long as you do the deep breathing. But sometimes what happens is that you start breathing, you might not able to do the blow breath as well, okay. So what you can do is like you can do the pattern breathing. So what you're doing is like you're breathing in 3 times, we'll breathe in 2 times, okay. 1, 2, and 1, 2. Okay, so sometimes if you cannot breathe in too much, you can breathe in 2, 3 times and then you breathe out. Sometimes breathing out is difficult, so we'll just do the chest breathe, and sometimes you can do like that also. Breathing in once. You can do that also. So we call this one as a pattern breath. Okay, so that is basically the type of breathing which you can do during the contraction. Okay. Contraction, as I told you, breathing, why we tell you to breathe, okay? It gives good oxygen supply to your baby as well. It gives you more confidence. It reduces the pain, right? It gives very less stress to your baby as well. And you're helping your uterus so that it can get a very good blood supply around the area, okay? So basically, this is what happening during the whole breathing. So when you have the contraction, remember, I am strong. My body is strong. With breathing, I'm going to help my baby and my uterus. Okay, so that is what you need to remember. Now, breathing is over. Okay, now during the contraction, that's basically the pushing phase. Sorry, the pushing phase. When you're fully dilated, when you're ready to push the baby out. Okay, listen to your doctors. Okay, because they will be telling you, okay, fine. This is when you have to push. Okay, so you have to remember that one. So listen to them and push as if you're going to pass a bad motion. Okay, so that is basically listen to them, and then that's how you have to push. Okay, most of the time you breathe in a little bit and then you. Okay, so we call this one as the J breathing, or you're using your abdominal muscle to push your baby out. So to demonstrate it here is a little difficult, okay, but then I'll just show again. I'm breathing in. Okay, so here I'm pushing it from my abdominal muscle. So that's the reason why during pregnancy, it's very, very important for you to strengthen your core, your back muscles, your thigh muscles, and your shoulder muscles. Okay, fine. So that is very, very important. So please meet your physio to start doing some exercises for that. Okay, now we finish with the breathing, right? Okay, now we will be talking about the positioning technique. So breathing technique you have to do during the contraction. During the relaxation phase, okay, you cannot just sit down and wait, oh, when will my contraction will come, how long will be the labor, the day will be very long. So try to engage yourselves by doing positioning technique, because positioning techniques basically helps reduce the pain, helps baby to come more down, this basically it helps in better positioning of the baby for birthing. Okay. And then third thing is that as you have more confidence. Okay. So what all positioning technique you can do. Okay. So during the relaxation time, you can go to the washroom, pass urine, empty your bladder, you can walk around the room. Okay. And then you can do slow dancing position. Bhavana will help you with that. So what you can do, you can either put your hands on your husband shoulder, or you can put your hands on your husband waist and then put your hand on his shoulder. Okay. Give your whole body weight to him. Whole body weight. Okay. And then slowly you can move your hips side to side. Okay. And then if you have back pain also, your husband can just nicely give you a very good rub on your lower back. Okay. So especially if you have a lot of lower back pain, there are some women who are having more lower back pain rather than the contraction. So especially you are the person who have a lower back pain, severe lower back pain when you have the contraction. This is a very good positioning technique which you can do. So see what happens is that when you're hugging someone, okay, there is more release of oxytocin hormone. You feel more protected. And the rhythmic movement helps the baby to come more down. Okay, and then your husband can give you more back rub. And then what happens like your back is free from the pain. Okay, so this is basically the positioning technique which you can do during the labor as well. Okay, during the contraction, even during the relaxation. Okay, so during when you're doing this positioning technique, slow dancing, let's say you started having contraction. Okay, so you continue doing this one and you can do the breathing. Just do the belly breathing. No problem. Slowly breathing in, slowly breathing, slowly breathing in, slowly breathing out, slowly breathing in, slowly breathing out. So that's basically very good positioning technique which you can do. Okay, so that is basically the slow dancing position. Now the other one, sitting in the exercise ball. Okay, so exercise ball is a very in labor we call this one as a birthing ball. It is a very important tool. Okay, now you might be telling me, oh, I am in pain, how will I like adjust myself? Okay, so what you can do, your husband can sit behind in a chair and then you can sit like this. So basically what happened here is that chances for you to fall is very less, right? So what positioning technique can you do? What movement can you do? So especially what happens when you sit on the ball, right? What you can do is that your perineal area, around the place you pass your motion and your vaginal area, you press your perineal area on the ball and nicely you do the circular movement. Okay, clockwise and here is that you are massaging the perineal area, you're relaxing those area, right? So what happens when you relaxes those area, it helps in bring the baby head more downwards. Okay, and it really relaxes your back as well, and you'll not feel the baby weight on you. Okay, so that is basically the ball exercise which you can do during your labor. And then we have so many different kind of exercises which you can do during your pregnancy, which you can get in touch with your physios in your center, and they will teach you a variety of exercises with the exercise ball. Okay, so this is one of it which you can do during your labor. Okay, now comfortable. So let's say you're sitting down, right? Your husband can nicely give you this upper back massage also, right? Okay, so all these things you can do during labor. Labor, make it more interactive, make it more fun. Okay, because this is the time which you're going to remember your whole life. Don't just be upset. Okay, it is a very beautiful transformation for you, right? Okay, it's a beautiful transformation. From a woman you're going to be a mother, right? Okay, so it's a beautiful transformation. So grace each and every part of it. Okay, try to enjoy the labor, though it is difficult, right? Okay, now let's say your doctor is telling because of some reason you have to lie down, or you are already in the transition phase where you're already 8 centimeter dilated, let's say. Okay, then they might not let you sit around, they might not let you move around. Okay, what can you do? Okay, but you're having a severe lower back pain. If you are only on the bed, what can you do? So we can do the hands and knees position. Okay, so we will do the hands and knees position. Yeah, come on your hands and knees. Okay. Sorry. Okay. Go a little forward. Okay. So this is the hands and knees position. So in this position, what you can do is that you can just lean forward and backward, right? A rhythmic movement with the contraction. Your husband can just give a very good yeah, you can nicely move your hip as well, right? And then if you want, and this is your hip, right? Your husband can nicely squeeze your hip. Okay, so it basically really releases the tension on your lower back as well. Nicely, you can rub your back, okay? And using this part of the hand, so your husband can just press it, just give a nice circular movement, clockwise and anti-clockwise. Okay, so this also you can do. So I'll just show this one in a standing position, okay, after some time, okay? So this he can help you with this as well. Okay, fine. So that is basically the massage. Okay, so we'll just show them. Okay. First, what we will do, we'll do the side lying position. In the side lying position, you can lie down on the side and a bit like okay. So you can lie down on the side. So positioning technique is basically to make sure the pelvic outlet is still maintained for the baby head to come down, right? So if you're putting your legs like this, the pelvic outlet is not maintained. So what you can do, you can keep a pillow in between your thighs like this, okay? And then you're still maintaining the pelvic outlet also, you're taking rest also, okay? And that's how you can you can go through the labor. Now I will quickly show the massage. Okay, so we do you face inside. Let's say you are in this side lying position and your husband is there and you start having a lot of back pain. So how can he help you? Okay, so what you can do, as I was showing, using the knuckles, if you want to press it nicely, you can do clockwise and anti-clockwise. If you don't want to use your knuckles, no problem. You just use the palm of your finger. Nicely, you can do this. Okay. That is one. Another one thing is that use the palm of your finger, go to and fro movement around the skin. Okay. So that you can do. And nicely, you can just rub the back from to down. Okay. So this massage also you can do even when she's lying down, even when she's sitting down, right? So that is how you can help mama during the labor. Okay. Now let's say you want to sit in an inclined position. Okay. Now, how will you sit down? So we will sit in an inclined position. So our bed in the hospital are all adjustable. Okay, so let's say we are inclining the bed to almost like 60 degrees. Okay, yeah. So what you can do is that you can put your legs wide and you can keep a pillow on the side. So what happened here is that again you are still maintaining the pelvic outlet, right? So all these things we know about it now, right? Okay, so yeah. So this is the last positioning technique which we can do, right? Okay, fine. So I will just give a summary now. Okay, fine. So we were talking about the stages of the signs of labor, 4 signs of labor. I hope you remember. Then we talk about the stages of labor. We talk about this. What are hormones going on in your body? How is good hormone and what is bad hormone during labor, right? You know about it now. You know the breathing. You know the positioning technique, you know the massage now, right? So you have so many things in your kitty now, right? Okay. So I hope everyone will remember at least some of it, okay? And then if you can join this session, I hope you can inquire in each of your center when the Lamaze session is happening in the center, okay? If you can join in physically, it would be great. Okay, please go and join. It's pretty fun. Okay, and you'll get much more information. You will get the hands-on also. So if you have any doubts also, you can still ask because Dr. Surya Lakshmi is still there to answer your doubts. Okay, for another 10 minutes. Okay, and you'll be having a session guide as well at the end of the session. And please give a review about it. Okay, so how is the session going on, right? Okay, so we are happy that you have joined. All the best, and then have a very safe delivery. Thank you.